Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are super excited to have Julia Salazar on our podcast today discussing pelvic floor therapy. So, Julie, welcome to our show.
Hi, thank you.
Tell us a little bit about your history, and then we'll go into pelvic floor therapy.
Okay, so I am a physical therapist that after PT school, I became board certified in pelvic floor therapy. This is not a common certification. I think there's about a little over 500 of us nationwide currently. I have owned my practice here in Spokane for 5 years now, and we treat only pelvic floor dysfunction. So we have tailored it down because it is such a niche and very personal that listening throughout the years, treating clients, they prefer to come to a space where this is all that we do. So I treat men, women, and children, all ages, anywhere from 5 to you name it. I think I've treated a 99-year-old. With anything related to like viscera, so the abdomen, the pelvis. We do end up doing some orthopedic stuff, how it relates to pelvic floor. We just try to bring this to the local area.
So, Janet, what questions do you have for Julia?
Well, first thing that comes to my mind when we are talking about pelvic floor is there's so many candidates that we see or clients that we see that end up having hysterectomies. So tell us a little bit about how that affects your approach to pelvic floor, because that's something Shawn and I help with hormone replacement, but I feel like these women are really in a bad spot.
Right. So after a hysterectomy, the uterus itself is a very large organ. And so you're removing a large organ and not putting anything in its place. So all the structures around it, the intestines, the bladder, the rectum, everything is starting to fall into that void. This is normal and it is fine, but if it is not addressed appropriately and we're not giving the support we need through the pelvic floor, through pressure management, through activating our lower abdominal muscles correctly, that's when women start to run into trouble. You can get prolapse symptoms. This is when they have problems emptying bowel and bladder. We can get some urgency frequency and leaking because of it, because that uterus itself was actually a structure that was providing some support and now it's gone. And so I love the topical estrogen, and I have struggled in the past, and it's just education that we explaining to women that not all hormones are bad, and that especially topical estrogen, it doesn't go systemic, and it is helping get strength and blood flow to those areas that really could use it, and that just makes their therapy go faster and better.
Well, I appreciate that explanation, and I can honestly tell you that's the first time I've heard the explanation about a hysterectomy like that. Probably not a surprise coming from a physical therapist. That's what you guys deal with, right?
Right.
And I never even thought about it as, you have this large organ and now all of a sudden you have a void. And let's face it, that's why there's a lot of problems like prolapse and stuff, because that organ was holding stuff up, correct?
Exactly. Yep. And that's why people feel so differently afterwards. They'll even tell you, they're like, my insides don't feel the same. Well, yeah, because they've moved on you. So now we have to get used to the new you.
Right, exactly. So on the topical estrogen therapy and hormones in general, I love what you said about not all hormones are created equal. And Janet and I have to discuss that over and over again. And it's not just sex hormones, but when, we put hormones into one category, and Janet are kind of guilty of it because it's just easy to say hormones.
Mm-hmm.
But really, insulin is a hormone, thyroid a hormone, adrenaline is a hormone. And estrogen is way different than progesterone. So you really, really have to define the difference between each individual hormone. And we can't just say, if somebody has a history of breast cancer or uterine cancer, that all hormones are bad, because there are a lot of hormones that we would die without.
Correct. Yep. And then it's just finding somebody that can prescribe them for each individual person. And so that's what I like about what you guys do, is you guys can tailor your hormones to that person specifically and get them the right dosage that works the best for them.
Absolutely. And let's not forget about when we talk about topical estrogen, you see it a lot of these pelvic floor women and men too that have urinary incontinence, and
Oh, yes.
and especially topical estrogen is a great treatment for that. Many of the women that have urinary incontinence, they didn't have urinary incontinence when they were in their 30s,
Right.
because they don't have estrogen. So
Yep.
they don't lack some fancy drug like Ditropan or Detrol. I don't even know the latest and greatest, honestly. They lack estrogen, and a little bit of estrogen, and they won't have urinary incontinence.
Yep, because it's all about the blood flow, and the estrogen helps improve the blood flow, which helps the muscle. That's the muscle's food. I use that example, and I'm like, if you're starving it, then it's going to weaken over time. So we need to feed it so that way we can gain that strength. Another thing that a lot of people don't know is urgency and frequency of urination. That is a common symptom of perimenopause. So not everybody, but if you're having lots of hot flashes, lots of other symptoms, I will automatically suggest talking to their doctor about getting on a topical estrogen cream, because just even putting that on could possibly significantly decrease that urgency.
Absolutely. Janet, what kind of comments do you have for that?
Well, I think that's beautiful, because the problem of going down the road of having mesh or having a physical insertion of a product into your bladder or urethra is that there's only so long that those products can be effective, and eventually they're going to have to be replaced. And,
Right.
I'll throw my mom out there, she's 88. She can't have it replaced anymore. There's not viable tissue to actually do that for her, because she was depleted of all hormones. After she went through menopause, they took her Premarin away after 5 years. And so then, there's nothing. And so these women are left with just a catheter. I
Yes.
mean, that's their only, alternative, which
Yep.
to me is really sad. So,
Yeah.
So how do you help women besides the hormones in your therapy to help increase the tone in a natural approach that keeps them viable?
So what we find is most women, most people in general don't really know what a pelvic floor contraction is or a Kegel. So the first step is just teaching them that. The doctors don't have time, nobody sits down and talks to them about what truly is a contraction and what isn't. So most women are just happy when I can tell them, yes, they were doing it correctly, or no, they weren't. And then it's all about prescription of exercise. So to gain strength, you have to, strengthen in a certain manner. I have to know your fatigue, and then we push you right past that. But if we blow past that, you're just going to get frustrated and weaken over time, because you're not doing quality contractions at that point in time. And then it's building from there. The pelvic floor is just one of the core muscles in the body. So when I say core, it's your diaphragm, it's your transverse abdominis, which is your muscles in your stomach. It's the pelvic floor, which is the bottom, and then your multifidi, which are right along the spine. So those four things have to work together in order to make you have a strong core. So it's looking at that whole body, that whole structure. And a lot of people use different muscles. One will overuse muscles while underusing another. And if you've never had to physically feel that pelvic floor and use it, you're probably not. So those other three are having to get worked even more and having to take up the slack in order to stay strong. So we work with pressure management. We work with getting like the hips, the pelvis, the abdomen nice and strong. And getting those things to work together, so that way then that leaking doesn't happen.
So pelvic floor, and I'm learning, one of the best things about our podcast, Julia, is that I learn something every day. It's like I don't have to watch a lot of podcasts, because we do 2 of them a week, so we get to learn every time we do a podcast. And pelvic floor is probably a pretty general term.
Correct.
So we've already talked about it being used to help for urinary incontinence. What are some other things that pelvic floor is under? What is under pelvic floor? Urinary incontinence, maybe erectile dysfunction? I don't know, right?
Right. So we treat prolapse. Anytime you're going to have any surgery in the abdomen or pelvis, I always suggest coming to pelvic floor physical therapy. I use my example of a total knee replacement. Nobody thinks twice about you do PT before your total knee and you do PT after your total knee. Well, if you do it before, you find the muscle, you get used to it, we build the coordination, and then you also get nice and strong. So then after surgery, when things have been disrupted, your mind-body connection gets broken and we have to reconnect it. And then you were already strong. So you're going to weaken a little bit because there's some recovery time in which you're not doing anything. But then your strength will come right back if you've done your prehab. So I'm trying to educate the public about a lot of prehab. So any surgery, prolapse, the bladder, anything for incontinence, prostate cancer, endometriosis, if you're having any type of excision with that, even ablations, anything that can disrupt that connection from the mind body, that's going to be helpful to do pelvic floor work. We treat a lot of like bladder urgency frequency. We'll treat chronic constipation. We'll treat anything that has to do with like fecal incontinence. I treat a lot of children for bedwetting, chronic UTIs throughout the ages, from little kids all the way up. Endometriosis is huge. We're lucky in this area. We have a couple specialists in the area that are nationally known. So we see a lot of that. So we do a lot of education, a lot of pain management, and a lot of rehab post-surgery as well. We also treat a lot of testicle pain, which is, people don't think of that either. Testicle pain, pain with erection, pain with ejaculation, all of that.
You said, so you've really increased my curiosity. So
yeah,
tell me the science, the physical therapy science of treating UTIs, pelvic floor exercises and UTIs.
Yep. So UTIs, I usually will ask the client, by the time they get to me, they've had multiple. So like they're usually like quarterly, I'm getting them, monthly, I'm getting them. I'll ask them. So your doctor has cultured it. 9 times out of 10, that comes back as E. coli. Well, E. coli is the common bacteria that lives in our stool, and it has nothing to do with hygiene, but our stool, if we're chronically constipated, lives in our rectum. Well, there is a very short gap between the anus and the urethra. You have a warm, moist environment. That bacteria is not going to stay there. It's alive. It's going to move. So that is how we're getting a lot of the chronic UTIs, is I actually have to fix the constipation before the UTIs get resolved.
Interesting. I love it. I mean, great explanation by a physical therapist, one I've never heard before.
Let me throw this in there too, which helps with the hormone part of the scenario. Our hormones that we have in our body actually promote the right pH as well. So if the pH of the tissue is off, that allows for a bacteria to overgrow and not be in check naturally. So if we're into peri or menopause and we're dry and we're not producing the hormones that we normally would, and of course we don't have the mucus and the secretion that we normally would prior to this, then the pH balance is setting us up, not only the physical location, but the pH is not optimal for a natural balance of handling that bacteria that we normally carry.
Right. Yep. And we will see a lot of that. We'll see a lot of just chronic bacterial vaginosis, chronic yeast infections. And not that I'm curing those, but we're helping get the body back to its normal function.
Yeah. And I mean, it's definitely true. I mean, the vaginal tissue needs a pH of about 4. So an acidic pH to prevent bad things from growing. It has good bacteria in it that produces the acid to make that pH less favorable for yeast and for E. coli to grow. So if you disrupt that, then there's definitely an issue. So you also mentioned about erectile dysfunction. We talked about that a little bit. Will you go more into depth on that?
So with erectile dysfunction, it kind of depends on what's causing it. So normally you've had your workup, and if they can't find exactly what's causing it, or if it's structural, a lot of times it will be scar tissue or a fascial restriction. a lot of the times people will come to me and they're like, well, I don't know what happened. But when I get talking to them in a history, I'll find out that they have trauma in their past. Like soccer players, they'll get kicked. The ball will get kicked into their groin, and they'll have history of like falls on fences, that type of thing, where there's been damage in the past. It didn't show up then, but as again, we age and our tissues change and our body isn't working at its optimal level, that's when dysfunction starts to show. So then they come to me and I'll work scar tissue, I'll work fascial restrictions, anything to promote blood flow. 9 times out of 10, if we lack blood flow, then that's when we start seeing some impairments. So erectile dysfunction is all about improving the blood flow. So why is the blood flow restricted? The scar tissue, the fascia, or is it tight tension as well? A lot of men will overuse their pelvic floor. So chronic, like heavy weight lifters, over time, they will start to notice that one, deep squats start to be painful, and then it's getting harder and harder to get an erection. Well, that's because their muscles have gotten so tight because all they're working on is strengthening. They're not balancing it with relaxation and stretching. So that tension then cuts off the blood flow, and slowly over time, things start to change.
So it's an overuse issue for them.
It is, very much so. Yep.
So why should men do Kegel exercises? I'm guessing you promote that. I'm not sure.
I do.
Okay.
Just like every muscle, you need to work it. You have to make sure that you relax as well. So the contraction is just as important as the relaxation. You have to go through the full range of motion is what I tell people. Men should do Kegels appropriately because one, if by the off chance when you get older, you get prostate cancer and they want to remove that prostate, if you were reliant on that prostate to keep you dry, then the only thing that you have left afterwards is the sphincter and your pelvic floor. And so those are the men that struggle the most with urinary incontinence post-surgery, because now they're having to find that muscle, make that connection, and now they have to get strong when they're not in their prime. So again, the blood flow, we don't have as good a blood flow, so it's going to take a little bit longer to get nice and strong. Yep. So finding that muscle is key. And I always tell my men, look in the mirror before you go to take a shower, undress, turn sideways so you can see yourself in the mirror. And if you're doing a pelvic floor contraction correctly, you're pulling penis up and in, or even raising those testicles up like you're going to hit cold water, and nothing else should move. So your butt muscles shouldn't move. Your abdomen shouldn't tighten up top. Literally a nice, like, 1/4 of an inch movement. It's not very big. That's all you need. And you should be able to hold that there and breathe. Now, if you have to like suck in and hold your breath and that's the only way you maintain it, then you're not strong and you're not doing it right.
So how long should you maintain it? I'm pressing right now.
So 2 kinds of muscle fibers. So you got to do a quick flick. So you're just going to squeeze and then instantly let go. Okay. So you're going to do that. You should do that. Oh, I don't know, like 3 to 4 times a day, at least a set of 10. Then you have to work the endurance muscle fibers, the slow twitch ones. So that you're going to do a 10-second hold. So that's where you have to maintain your breath. No other muscles are tightening. And you have to hold that for your 10 count. And then you have to let go. And you don't want to contract again until you have fully relaxed. Because if you don't, I give everybody my bicep and I'm like, if you'll get stuck like this and then you're going to strengthen over and over like this, your bicep will never get strong. So you have to fully relax and fully contract to get nice, strong muscles.
And if anybody's ever tried Kegel exercises, as a man, I'm speaking for myself, it is, what you're talking about is very difficult.
It is.
It's not easy at first.
Most people want to hold their breath. And then they're like, I can do it now, but you have to breathe because that's functional. We breathe in life.
And so when do you suggest men, obviously, just like exercise in the gym, it's really no different, right? I mean, we exercise in the gym to prevent problems later on, so we can be strong later on. When do you suggest men start doing Kegel exercises? Honestly,
at puberty. One of my goals, again, is educating the community. I would love to get into schools and talk to them about what is normal. Because so many of my women and men come to me and they've tolerated things for so long. And they're like, I just thought it was normal. Nobody told me. One of the biggest things for women is they would have painful periods to the point that they would go home. That's not normal. Heavy clotting, passing clots during your cycle, not normal. Not being able to wear a tampon because it was uncomfortable or it hurt, again, not comfortable or not normal. A lot of these things are super common, but they're not normal, and there's really things that we can do about it. And it's those women that don't actually come to me for even leaking or anything like that. It's pain with intimacy later on in life, because if they can't tolerate it then, they're not going to tolerate it later.
Yeah, those are really, really good points. Janet, what other questions do you have for Julia?
Well, I just want to say that this is something that I think is not talked about. It's kind of almost taboo for people. So bringing it to the forefront and bringing it to younger women is super important, because even when I'm having just Q&As with women, it's surprising to me, like what you said, what people tolerate, because they don't realize there's something different and they shouldn't have to tolerate that. Shawn and I have even counseled couples that were told, after menopause, everybody has difficulty having sex. So let's just throw some lidocaine. Well, that's not true.
No.
That's not the answer that you would like to have. So whether you're male or female, there are solutions that are available to you, whether it's a muscular blood flow issue or if it's a hormonal issue, there's answers. And why tolerate something that's going to put you in the box and make you not enjoy life optimally? Because I think that's really sad.
Mm-hmm. Yep. That I love it when we have patients leaving here, all ages, that are just thrilled that they no longer have to deal with the uncomfortableness or the embarrassment. And that's a lot of it, is just bringing the education out there, allowing people to talk about it, making it so it's not so taboo. And it's changing. I do see it changing out there, but it still takes a long time. And there's some cultural differences too. I've worked in a few different states, a few different areas, and different cultures. I just know what to expect. Some people I'm going to have to educate more than others and let them know that there are solutions out there. And if they want, they don't have to live like this.
Yeah, for sure. So what do you see as, what is your ultimate goal when it comes to your practice and educating people on pelvic floor?
My goal would be that everybody, men and women, understand what is normal for their body, what is normal function. And then I want it to be thought of at the very beginning. Like I said at the beginning of this podcast, if you're going to have any type of abdominal or pelvic surgery, they should instantly throw out, well, why don't you try some pelvic floor PT first? Even if you have surgery, that's fine. That I don't view that as a failure. But what we can do is we can then make your surgery, your rehab happen faster, and we can make your surgeries even last longer. Certain, like prolapse is a great example of, if they get to a certain stage, surgery is their best option for quality of life. So I am all about that, but that doesn't mean that pelvic floor therapy isn't appropriate for them. They got that way because something was not working correctly. It's usually pressure management within the body. And so if they aren't managing their pressures good before surgery, after surgery, they're not going to manage it well. And then their surgery will not last. So I promote it to surgeons that way, in the sense of, I can make your surgical outcomes that much better. I promote it to patients, saying that, hey, you can recover faster and easier. And if you're going to go through this, let's make this the best possible outcome for you.
So people love to hear about stories. Tell us a success story of yours.
So one that hit home to me when I was really young in my career and got my passion for this field going, and that's kind of what stemmed me to even go as far as I have in creating my own business, was there was a young lady that came in for pain with intimacy. And her belief system was that she waited until marriage to have sex. And on her wedding night, they were unable to have sex because it just hurt so bad. It was a newlywed couple. And so they were struggling. They were working through it. They were trying. She got to me and I worked with her. There was lots of different things that were going on. So it took a little bit of time and patience, but we found ways to incorporate her husband so that he felt helpful. He felt involved, and that she felt supported by him. And after, it took a little bit, probably about 3 months, she came back to me thrilled because for the first time ever, they were able to have intimacy pain-free. And it just changed their whole marriage. They were just so much closer. They were so much happier. And so that just got me, because if it wasn't for what I was able to give her, she had tried everything else. She didn't know if they were going to make it.
Wow. They're always great stories when you basically, you change their lives, change their marriage, change their lives, really.
Mm-hmm. Yeah.
So Julie, as we wrap this podcast up, tell us what you have a passion for. I mean, I think it's pretty obvious.
Yeah.
Right. My passion is just to educate the community on what physical therapy, and especially pelvic floor therapy, can do for everyone. I started most of my practice down in California, and down there it's everywhere. Everybody knows about pelvic floor PT. And so when I moved back to Washington, and specifically Spokane, I was kind of disappointed. Spokane is big to me. I'm from Montana, and so Spokane is still big city. And to not have anything like this, I was really disappointed. I was like, we need to change that, and we need to change our outlook on our healthcare system, on what we can do, on our options out there. I just want to give people options so they don't think that they have to only do surgery or only do a medication.
I love it. So if anybody has any questions, what's the best way to get a hold of you, Julie? We're going to stream your website here.
Yeah, so best way is to go on the website. There's a contact us button on there. You can either call us, it'll show you your phone number, or there's an email that you can get to as well. So it's corepelvicpt.com.
Awesome. I love it. Well, our goal of this podcast, Julia, is to educate and empower individuals to take charge of their own health. And you help us realize that goal. So thank you so much for being on our podcast today and helping us realize that goal.
Thank you.
And thank you, listeners and viewers, for tuning in to Health Boots with Shawn and Janet Needham. Tune in Thursday to our midweek podcast, 8 a.m. to 9 a.m. Pacific Standard Time. Thank you for tuning in.